Good afternoon, everyone. My name is Danielle Williams, and today I will be talking about breastfeeding positions and weaning. I will be using my 4-year-old son, Javon. Say hi, everyone, Javon.
Hi.
He will be my guinea pig today. He has been weaned for the past 2 years now, but he is very excited to help me with this video. Before I get started talking about breastfeeding positions, I definitely want to remind all mommies to remember to go pee before you nurse. You will regret it because your baby will not want to let go, especially around the times when baby is teething or cluster feeding. You're pretty much stuck there for a while. Also, have your Netflix queued up, have some music playing, have a game if you like games, or a good book to read. Make sure you have everything you need, snacks and water or juice, whatever you want and need before you start breastfeeding. Please have it. Okay? So, my favorite position was the laid back and reclined breastfeeding position. As my son got older, he was a lot more mobile, and it was just easier to be able to lay back on the bed or lay back in a chair and just get him to suck this way, and he's able to be mobile, moving around, moving his legs and trying to do flips and becoming a professional gymnast at that point. It was around 6 or 7 months is when this position for me was very helpful. The next position is called the cradle hold. It's where your baby is on the side, his tummy is towards you, and your forearm is supporting the baby's head and neck. Now this is perfect for newborn babies, any age really, but especially for newborn babies. As you can see, my breasts are rather large. I wear a G. And for me, I could not breastfeed without a boppy in the beginning because I was afraid of smothering my poor little baby's face. So what helped would be for me to hold my breast up while he nursed, to ensure that he was able to breathe and nurse. But this position is very helpful. As I get older, it's a little more of a struggle, but we'll get into other positions for older babies. The next position I'm going to talk about is the main position that you learn when you're in the hospital. It's called the football hold. Now, at this position, this is very helpful for women who are well endowed because it allows you to see the baby's face and can tell if you still see his nostril when nursing. You will place the baby on his or her back on either the bed or propped up on a pillow, and you would just nurse your baby. For all my moms who had C-sections like I did, it was very difficult in the beginning to be able to breastfeed because the baby would move and touch the incision. So a great position that I did was the laid back position where I would lay on my back. Baby's head would be on this breast or on this breast. And basically you can hold baby away from your incision, sideways, basically away from your incision, and still be able to nurse baby. Another great position is the upright position. Another really good position for mobile babies. They don't want to lay down all the time. So if you have them straddling you like this, and letting them nurse, that will be a great position, as well as even if they're in a baby carrier, you can let them nurse that way as well. Another great position is the side laying position. You can be laying on your side while baby dream nurses, or if you just don't feel like having to hold baby, you're tired, you just want to relax. So nursing your baby on your side is a great position as well. Another really great position to be in if you have clogged ducts is dangled feeding. Your baby will be on his or her back, and you simply dangle your breast over your baby's mouth, and your baby will nurse as you massage the breasts to get that clogged duct out, okay? For me, when it came to weaning my son, the easiest thing to do, well, to start out with, was night weaning. By the time he was 2, I started being more consistent with my bedtime routine that I had for him. I would first give him a bath and then brush his teeth, give him a bedtime story, and just be consistent with my nighttime routine. I also quit bed sharing with my son because I believe that helped transition him into not wanting to nurse on demand at night because he didn't smell the milk when he was laying next to me. Other tips on weaning, we only advise gentle weaning. Gentle weaning is just that, weaning gently. So unless you and the baby are ready, I don't advise you start weaning because even the mother can be affected by weaning. It's called post-weaning depression. It's a thing. Lots of moms get sad, me included, once they stopped breastfeeding. It was an emotional connection with your baby and you no longer have that close bond. Well, you don't think you do. And that can be traumatic for you and the baby. You also have to look at the time you plan to wean. Like if baby is teething or sick or hurting for some reason, they're going to want to nurse more than likely because it's their comfort. So try and be mindful of that as well. Some tips on how to gently wean are: you can try redirecting baby, having someone else put the baby to sleep. You can offer toys or food or water or milk in a cup if you'd like, but we don't want it to be a traumatic experience. Crying it out is not a good method. It's very damaging for baby. Until next time, everyone, thanks for joining us. Say bye, Javon. Bye.